So I want to explain a simple principle that I hear all the time. And what we've done is we've taken this word sciatica and we've turned it into kind of a catch-all phrase. Meaning we'll have people coming into the clinic and they say, I have sciatica, which basically means to them it means that I have pain shooting down my leg. Now there's a very important difference between true sciatica and referred pain. A true sciatica is going to cause pain to go all the way down into the leg, into the foot. So when you have, for example, here's L4, here's L5, here's the sacrum. When you have an arthropathy or a radiculopathy that's pushing pressure on one of these nerves that's involved into the sciatic nerve, it's going to cause pain most of the time. There's always exceptions, but most of the time it will cause pain going all the way down into the leg, all the way down into the feet. Especially the lower we get into the nerve roots, it's really going to cause that to go down. That's true sciatica. What most people come in and complain about, well, I shouldn't say complain, but most people's complaint is they have pain going into their leg, but it's not going past their knee. Now, could we get a nerve impingement up here in the higher part of the lumbar spine and cause radiculopathy to go, radiation to go into the leg and not past the knee? Sure, we could. But most of the time where that's coming from is you have joints in your spine here called facet joints. In the lumbar spine, the facet joints are going to guide the motion of flexion and extension. When these facet joints have facet arthropathy, that's what's going to cause the symptoms to be shooting down into your leg. So when people come in and they consult with me about, hey, I've got back pain, I've got sciatica, and I want to do a stem cell injection. That's when we have this conversation because it's very important. If it's a facet arthropathy, we want to inject these all day long because this is where our highest clinical success is. Why? Accessibility. If you take a needle and you put it into the muscles over the spine, those paraspinal muscles, we can get really, really close to that facet joint and get that injection right near that facet joint, and it's going to clean it up. However, if it's a disc herniation that's bulging out and causing a true sciatica, it may or may not reverse that herniation, and that's just a conversation we need to have. We've had herniations where we did stem cell injections where it was the best thing they ever did. But we always have that conversation of, hey, if this is a disc issue, this may or may not work. Here's what the chances are. Here's what I think you should expect. So that's the difference between a true sciatica and pain going down into your leg from a facet issue.